Welcome to Module 1 of the ESPT training course. This module is focused on identifying your priority program question or questions and corresponds to Module 1 of the ESPT tool. And now let's get started. By the end of Module 1, you should be able to explain why entomological surveillance should be directed by questions and use the ESPT to identify and formulate programmatically relevant questions to inform the design and collection of entomological surveillance data. Before we get started, let's do a quick review of our training checklist. First, it is useful to have a copy of the ESPT tool in front of you, either electronic or paper. Second, in order to actively participate in the exercises and to take notes, you will need either a notepad and writing utensil or a computer. Third, you will need a stable internet connection and functional speakers or earphones if you plan to use the audio voiceover. As a reminder, an orange slide denotes an illustrative example which we will carry forward in each successive module. And a gray slide signals an exercise which can be done individually or in a small group and should take between 10 to 20 minutes to complete. Let's first orient ourselves to where we are in the ESPT navigation tree. We are starting with Module 1, which asks, what is your question or questions? Module 1 is a short but very important guide to formulating a priority program question. This refers to a question that, if answered, would inform an important program decision such as an intervention selection. In the ESPT, 6 question themes are identified to help you think through the different types of program questions. Example questions are listed for each theme in the ESPT. Reviewing this may help trigger some important questions for your program. Let's begin by reviewing several key concepts that are important to understand for Module 1. First, a driver of transmission or transmission driver, which can be defined as a factor that contributes to malaria transmission, such as a change in vector bionomics, climate, population movement, as well as operational inefficiencies like stockouts of key commodities or suboptimal coverage of vector control interventions. Second, a gap in protection is a term used to describe a circumstance when an individual and/or household is potentially exposed to a malaria infection, that is, an infective mosquito bite, due to a lack of effective and/or adequate protective or preventive interventions in place to reduce the exposure to mosquito bites. And third, a high-risk population, which refers to a group of people who share socio-demographic, geographic, or behavioral characteristics that place them at a higher risk of infection, such as low utilization of health services or interventions, or behaviors associated with increased exposure to Anopheles mosquitoes, the vector of malaria parasites. For entomological data to be useful for malaria program decision making, data should be collected with a specific programmatically relevant question or questions in mind. Such questions, for example, could include, what is driving an increase in transmission in my district? Or are local vectors still susceptible to the insecticides we currently use for indoor residual spraying? The identified program question directly informs the entomological surveillance plan, including the selection of appropriate indicators, sampling methods, survey design, and sites. Identifying and formulating a priority program question is the very first step in designing your entomological surveillance plan. Now, as you start to think about formulating your program question, there are several considerations that may help with this. First, you should review any available epidemiological data, including case numbers and recent trends. This can help trigger program questions and highlight geographic areas or populations that should be prioritized. Second, programs should consider any upcoming decisions that need to be made where additional data or information would be useful. Such decisions may include the selection, procurement, and targeting and tailoring of vector control interventions, or decisions related to annual work planning, for example. Identifying your program question can often be challenging. Therefore, we have grouped the most common malaria program questions into 6 themes. For each theme, we have provided example questions that emerged from earlier application of the ESPT. We will cover the 6 themes one by one over the next few slides. The first theme is about the performance of current vector control interventions, such as indoor residual spraying or long-lasting insecticide-treated nets. Here, example malaria program questions include: what is the baseline vector composition, distribution, and bionomics in an area where interventions are currently deployed? How do current interventions affect vector populations and malaria epidemiology over time? That is, do current vector control interventions such as long-lasting insecticide-treated nets or indoor residual spraying result in a change in vector behavior or a reduction in vector populations, human vector exposure, or malaria incidence? Are local vectors susceptible or resistant to current insecticide-based interventions? And is indoor residual spraying effective in Area A based on vector behavior, human behavior, and insecticide susceptibility? The second theme relates to the selection and evaluation of supplemental vector control interventions such as larval source management or topical repellents. Under this theme, common malaria program questions include: what is the baseline vector composition, distribution, and bionomics prior to introduction of a supplemental intervention? What are the gaps in protection, and what are the available interventions that can address the gaps? A reminder that a gap in protection refers to where an individual or household is potentially exposed to malaria-infected mosquito due to lack of effective or adequate protection or intervention being in place to reduce that exposure. Next, where and when should a supplemental intervention, such as larviciding, for example, be deployed in Area A? And lastly, how do vector populations, specifically their behaviors and species composition, change after supplemental intervention is introduced in Area B? The third theme relates to drivers of malaria transmission, which may be particularly important in areas experiencing an increase or plateauing of malaria cases. Here, sample malaria program questions include: what are potential entomological drivers of malaria transmission in Area A? That is vector behavior, species composition, or susceptibility to insecticides associated with an increase or plateau in malaria transmission. Next, how does human behavior affect intervention usage, acceptance, and exposure to vector biting? And what is the association between vector populations, rainfall, and malaria incidence, and how can that association inform the timing and targeting of vector control interventions? The next theme, and a common one, is the reduction or plateauing of funding or capacity for entomological surveillance for your malaria program. Under this theme, some program questions include: what are the priority entomological surveillance activities if there is a reduction in available funding or capacity? What are the minimum essential indicators that should be collected in order to adequately inform our vector control strategy? And what entomological surveillance activities can be conducted with current program capacity? And perhaps what additional activities could be conducted with support from research or implementation partners? Theme number 5 refers to changes in receptivity in prevention of reestablishment settings. Sample program questions under this theme include: how do vector populations change over time in areas trying to prevent reestablishment of malaria? How do these changes increase the potential for malaria transmission if imported parasites were introduced? And what actions should be taken to address critical changes in receptivity in Area A? The sixth and final theme of common malaria program questions is enhancing and tailoring entomological surveillance activities. Sample questions include: can CDC light traps serve as a valid proxy for human learning catches in Area A? Can Anopheles species X be successfully reared in an insectary for insecticide resistance testing? And which method is most effective for collecting indoor resting mosquitoes in Area B, pyrethrum spray catches or indoor aspirations? Now, let's look at an example which we will return to in subsequent training models. I will start by providing some context for our fictional village of Katosha. This scenario is a common one in many countries. Despite high coverage of bed nets, malaria transmission persists in Katosha, and we have very little information about the vector composition and bionomics in Katosha because no entomological data have been collected in the last 5 years. Now, what questions come to mind here? Take a few moments to think about some potential program questions related to this scenario. You have about 30 seconds, and then we will go over some examples together. This could include, for example, what is the actual level of bednet use in Katosha? Or when and where are people being bitten by Anopheles mosquitoes? What time of the day are the vectors biting? And also, what might be some gaps in protection in Katosha? Are there points or periods where humans are exposed to Anopheles bites without any protection in place? Considering these various questions, we land on the overall question of are bed nets an appropriate intervention for the village community of Katosha? This question would fall under Theme 1, Performance of Current Vector Control Interventions. Now it is your turn. For your first exercise, which you can do individually or in a small group, identify a priority program question that is specific, measurable, and realistic. Here are some tips before starting part 1 of the exercise, where you will formulate your question. Tip number 1, consider malaria program priorities and targets, pending questions, upcoming procurement or planning decisions, changes in budget or capacity, and drivers of malaria transmission. Tip number 2, consider the specific geographic area and target population, as well as available entomological and epidemiological baseline data and the timeline. And tip number 3, review the 6 ESPT question themes and sample questions to help remind or prompt you on common malaria program considerations and questions. Now, please take 10 to 15 minutes to identify and formulate a program question that is a priority for your area. You can identify more than one question, but please choose just one to carry forward and focus on in the remaining modules. Please pause the video here and return when you have identified a potential program question. Welcome back. We assume you have now identified a potential program question. As part 2 of this exercise, we ask that you take another look at your question and reformulate it as needed to ensure the question is as specific, clear, and concise as possible. If you are taking this training in the same physical space as others, you may want to share your question with your partner to make sure that it is as specific, clear, and concise. Please pause the video here if you need more time to reformulate your question. And finally, as a reminder, you will use the priority program question you identified here for all remaining participant exercises, so please keep this on hand. Congratulations, you have now completed Module 1 of the ESPT training. At this stage, you have used the ESPT to identify and formulate a programmatically relevant question. And next up, we invite you to proceed to the next module, Module 2, on selecting minimum essential indicators. On behalf of UCSF's Malaria Elimination Initiative, thank you for your interest in the ESPT.